How you doing, Todd?
Doing very well, thank you, Lester. And yourself?
Oh, I'm just fine. I'm just holding in on this nice, breezy, windy day out here. This wind is really breezing on us. Uh, Now, I understand that you have a clinic in Granada Hills, Acupuncture America. But before we get into talking about the different services and things you offer at Acupuncture America, why don't you give us a little background, let our listeners know a little bit how you got started in natural alternative health.
Okay, well, I was looking for something to do to help the community, and I thought that acupuncture and herbs would be a good way to go. It was a blooming field. It was just in the beginning stages here in America, although we all know it's several thousand years old in China. And it was a more natural approach to healthcare, which attracted me to it. Also, herbology is very interesting to me because I find it great that Mother Nature, that God has given us these medicinals, and they are medicine in plant form and tried and true. All cultures have used these, and so it's pretty exciting, and that's what brought me to study.
All right, all right. Now, acupuncture is something I know a lot of people are not too familiar with. The Chinese use it a lot, and from what I understand, it's usually the regular or native type Chinese doctor is an acupuncturist.
Yeah, that's true in the past. And nowadays in America, there are a lot of different races studying acupuncture because it's such a profound medicine and a complete medicine. And acupuncture and all of Chinese medicine can really treat any disease or disorder. There are some that we definitely believe that you need to seek other modalities as well, but we are very good complementary medicine. In some cases, such as AIDS and cancer, you want to stick with your Western doctor. I can't stress that enough. But with side effects with the drugs from the Western medicine, acupuncture can help tremendously with nausea or vomiting or neuropathy, these types of things, that anxiety, depression, that Western drug has side effects with. Acupuncture can really help balance the body, bring back a homeostasis, and alleviate a lot of those side effects. So in those major kinds of diseases, that's where it works really well. But on its own, gynecological problems, aside from tumors, respiratory problems, digestive problems, and of course, any type of pain, headache, muscular, joint pains, Chinese medicine works very well with. Also, we're finding that acupuncture works extremely well with drug addiction. Just straight acupuncture, what we call ear acupuncture. You just use ear points, and some practitioners can also add in some body points as well. But really, the ear acupuncture for chemical dependency works beautifully. The thing is, you have to be committed to go day in and day out, literally, at least 3 times a week for several months. But it has a great track record, and there are a lot of free clinics that deal primarily with that, especially in Santa Monica and downtown LA.
Okay, now you're saying that acupuncture, from what I understand, it doesn't just treat symptoms, but it actually can heal or help degenerative type situations or diseases also?
Yes, it can definitely help with that. What we do in our clinic and most acupuncture clinics is you come in for the first visit, usually takes about 2 hours, and that includes about a 45-minute treatment, because we're asking a lot of questions. There's a very in-depth intake, and we want to know everything. Everything that your Western doctor doesn't really care about is important to us, because we understand that we treat the whole person, and everything from how you're feeling when you wake up in the morning to if you're sleeping well or having skin problems or anxiety or anything is important to us and helps us in our diagnostic procedure. And through that, then we get what we call the root of the problem, and then we treat the root. So initially, we'll treat the symptoms because that's important to alleviate the symptoms first. But then we go in through successive treatments and get at the root of the problem, and therefore we can alleviate the cause of the disease.
All right, now where have I heard that phrase before? The root of the problem. That's our motto here at Herb Talk. We get to the root of the problem. Now I understand you were saying that you'll have to go through several treatments in acupuncture, and myself, I've had it once, and I understand that the needles, some people seem to fear, those needles. Tell me about that. Now, are those needles, do they hurt, or can you give our listeners a little more insight as to the needles, because they may not be too ready to jump into acupuncture?
Right. Well, okay, that's a fair question, and I'll have to be honest. First off, they're not hypodermic needles. They're so very, very thin needles, and you can usually fit 10 or 12 needles in the head of a hypodermic needle. So they're very small. But you do feel oftentimes the initial insertion of the needle, and it's just a slight little prick. It's not a major pain at all. But I have to be honest and say you do get some sensation. Also, when the needle is inserted, we manipulate the needle because we want the needle to attract what we call the chi, the energy of the body. And when we do that, you will feel a distended feeling, or maybe a warmth, or an electrical feeling, or a numbness, or a slight pain. And that's important in acupuncture because that means that the needle is grasping the chi, and through that, then that's how the healing comes about. But it's not a prolonged pain. When you feel the pain, you let the practitioner know, okay, I feel the chi, and then the practitioner stops and you don't feel it anymore. Oftentimes, you may not even feel the chi, and you still will get results. And some points hurt worse than others. If you're going in the palm of the hand, it hurts very badly because you've got a lot of nerves in the palm of your hand. Ear might hurt a little bit more than if you're going into a fleshy part because there are a lot of nerves in the ear. Also, we do different depths. If there's a real fleshy part, like in the pocket between your thumb and your forefinger, that's a very fleshy part, you can insert the needle a good ½ inch there. Whereas if you're on the dorsal side of the hand, there's no fat at all, you do an oblique insertion. So there are different insertions, but basically you want to get a sensation of chi, and then we call it sensational acupuncture because you do get a sensation.
Okay, now I can attest to that. I have had acupuncture once, and like Todd said, I really didn't feel any pain once they inserted the needle. I was kind of scared at first because, sticking all these needles in you, we're not used to. But I didn't feel any pain once they had the needle in, and as he said, I did feel like a warming effect or something when I guess the chi was recognized, when they hit the chi. Now, tell us a little about the Chinese herbology and how you all use that at Acupuncture America.
Okay, well, Chinese herbology is somewhat different from Western herbology in that Western herbology often will use only one herb or maybe two herbs. Chinese herbology uses many herbs in combination. We call them herbal formulas. And most herbal formulas have anywhere from 3, sometimes even 2, but mostly 3, 4, even up to 12, 16, 20 herbs in a formula. And the reason that that's important is because they work together synergistically to bring about the completion of the problem, alleviate the symptoms, or get to the root of the problem. And you use a combination of herbs. For instance, if you have a blood disorder or something, you might want to use several different herbs in combination, and one may tonify the blood or strengthen the blood, whereas the other herb will help move the blood so that it doesn't get stagnated, and another herb will help move the chi because the chi and the blood move together, and if the blood is only moving and not the chi, then you can also get a stagnation. So you want to move both together. Then you don't want to have too hot or too cold. Some herbs are really hot, so you have to add a few cold herbs to balance it out, and vice versa. Some are really cold, so you need some warming herbs. So that's how we make a balanced, harmonious formula, and that's the difference between Chinese herbs and Western herbs. And Chinese herbs have been around for thousands of years. Really, they started making literature around 500 BC, somewhere around there is the first literature that came out with herbology, but we think in fact that it was around much longer than that, and acupuncture is recorded even earlier than that. So it's been around a long time. And not only Chinese herbs, but herbs have been around the world forever. And every culture uses herbs, and oftentimes the same herb. So, you know that it's powerful.
Now, are there any myths out there about Chinese herbs or anything to that nature that you like to talk about?
Well, there are some herbs that are in the media a lot lately, such as ephedra, which is ma huang, and ginseng. And it's important to know that that these herbs can be detrimental if you don't know what you're using them for. Ephedra in Chinese medicine, like I said, you never use it by itself, you use it in a combination. So we use a very small dosage. And we use it for respiratory problems and for colds, what we call wind colds. And in the West, they seem to, because it makes you sweat and it brings your level of energy up, they've decided that it's good for weight loss. You know, in my opinion, then that is not a good thing, and it can be dangerous, and some people have even had heart attacks and died because they overdosed on ephedra. Ginseng's the same way. You know, you have several different types of ginseng. You have Korean ginseng and Siberian ginseng, which are extremely hot herbs. And here in Southern California, we do not need hot herbs in general. I mean, there are some cases that maybe they need that, but most of the time, no. And it can really raise your blood pressure, could cause hot flashes, extreme sweating. So it's not necessarily good. I would suggest American ginseng for Americans, for the most part, because it's a more cooling herb. It's Chinese white ginseng is more of a neutral herb. That's okay, but you need to know which ginseng you're taking, and you need to know, am I taking the root or am I taking the stem? You know.
And when you say they need to know, now should they seek out some professional herbologist or someone like that when they're trying to deal with illness or something using these herbs?
In my opinion, yes. You should not self-medicate. Herbs are medicine, and they do have side effects. And if you don't know what you're taking and you don't know what might happen if you overdose, you're basically self-medicating, and that's not a good thing. So, in my opinion, you should find a qualified herbologist or somebody who really knows what they're talking about. And that doesn't mean going to Chinatown and finding the Chinese guy in the China store. He's not necessarily an herbologist just because he's Chinese. He's most likely a clerk who's selling the product. When you go into the health food stores, these clerks really don't know the whole gambit of what herbs are. I mean, they might know, oh, ginseng gives you energy, but you know, ask them something else, and they most likely can't tell you. I'm not saying that about everybody. I'm sure there are a lot of knowledgeable people out there, but you want to be careful.
All right, now you heard that on Herb Talk. Now we're going to close out this section here. Do you have anything you'd like to add before we close, Todd?
Well, if I'd like to tell a short little story, if I could.
Okay. 1 minute, we're going to let Todd tell that story, and we're going to close out this section. But before we go, we want to give our listeners that address where Accupuncture America is located.
Okay, it's 10718 White Oak Avenue, Suite 4 in Granada Hills. That's off of Chatsworth.
All right. Now, you heard it on Herb Talk. This is your host, Lester McCurtis, and we'll see you next time on Herb Talk.